7 o'clock ding, and I'm on time. So let the stragglers come in and work from there. So I'm Dr. Twyman, for those who don't already know me. I recently launched Apollo Cardiology here in downtown Clayton. My focus has been preventive integrative cardiology for the past 6-7 years, and now that's my main focus, is working with patients at the earliest stages of disease, to do some early screenings of their vascular systems, advanced biomarkers and blood work. People have already had an event, heart attack, stroke, stents, bypass. I work with them so that they don't have the second event. So we've just been open for about 3 weeks or so, and the systems are starting to get in place. I hired my first assistant, Cassidy, who some of you might already start being in contact with. She'll be helping you get acclimated to our new practice. And you'll probably start noticing that I have more information going out online. So that's one of my big focuses over the next couple months, is I will have a lot more kind of content coming out on a YouTube channel, my Instagram, Facebook, and ultimately we'll have a podcast as well that tentatively titled Mission 106 Plus. 106 because my grandma Ola was 106 years old, and it's my record. I'm gonna try to beat her. So tonight we're gonna kind of introduce what health coaching is and how health coaching might help you. The way I think of health coaching is that somebody who helps you keep accountable to whatever health goals that you have. I frequently talk about a 4-legged stool as kind of your basis of health. If one of those legs falls off, you're not going to be as healthy as you want to be. So those 4 legs are your fitness, your nutrition, your sleep, and your stress. So every one of those things needs to be addressed to have optimal health, and health coaches can help you get to those goals that you need. So you might only see me in the office 2 to 3 times a year, and health happens outside my doors. So I can kind of put you on the roadmap, but if you're not able to kind of keep to the plan, you might not necessarily get the results you want, and that's where the health coaches can come in. So both of these ladies I've worked with in the past, and you might have seen us in Uninflame Me, you might have seen me on her podcast, and hopefully her TV pilot gets picked up soon enough. With much further ado, I'm going to turn it over to these ladies, let them give you their stories and how we can think health coaching might help you guys.
All right, so me first. My name is Amanda LaPlante. I have a master's in communication, and all things were going fairly well career-wise and in life until about 2012. I racked up my 7th autoimmune disease. Over the past 20 years, I had been accumulating these and a long list of medications to go along with them. By 2014, I was 50 pounds heavier than I am now. I spent most of my days in bed, and I had pretty much had to step away from life. Words like disability were being thrown at me by my doctors, of which I had 6 specialists and a primary care physician that I saw monthly. So things were in a pretty dire situation, and that was at age 33. So I realized that I needed to take some drastic action and make some changes. I didn't want to see myself go on disability and beat the record that my grandfather had set, which was disability at age 41. So I made some changes to my diet and lifestyle, and through diligent work, I was able to drop the weight, drop the majority of the medicines, and stay off of them. Sometimes I'm completely medication-free, other times I might have to do 1 or 2 until a flare settles. But it's a completely different lifestyle than what I had. I went from being, and by the way, in 2014, in May, Mother's Day, my son wrote me a card for Mother's Day at school. He was 7 at the time, and it was a flip card, and every page was something different about Mom. And on one of the pages, he said, "Mom is good at," and he drew sleeping. I went from being the mom that couldn't get out of bed to being the president of his PTO at a National Blue Ribbon School for 2 years. So I've seen the way that these 4 pillars can play a role in your health and how it's transformed mine. Once I saw that, I decided that I wanted to go back to school and study to become a health coach. I studied through the Institute for Integrative Nutrition, and it's been an amazing journey the last 2.5 years since I received my certification. I've been coaching people. I've coached a couple of hundred at this point, and seeing weight loss, reduced inflammation, reduced medication or need for, just generally people getting back to the lives that they were meant to live, and our world needs more of that right now. So I'm really excited to be here and have the opportunity to work with Dr. Twyman to support all of you. And I hope that if you have any questions, you'll be sure to share those tonight. I would be happy to answer any that I can, and I look forward to supporting you. My name is Angela Lamb, and you might have seen my movie, Uninflame Me, about my health journey. I was a creative my whole life. I have a bachelor's in psychology and commercial art with a minor in education. And up until 2004, I really didn't think about health. I was an obese child when I was a kid, and I had improved my habits as I got older. I didn't always eat everything out of a box, but I relied on it quite a bit until I turned 40, and I knew something was seriously wrong with me. I went to my primary care physician. They ran the standard test and came back and told me everything was fine. So I just thought, well, great, this is 40. But I was supposed to see that primary care physician 6 months later, and I never made it. I was hospitalized due to a blood clot. My blood work was all at dangerous levels. I was in the hospital for a week getting a revolving door of tests, seeing every specialist there was as they were trying to figure out what was going on with me. I was getting diagnosis and then getting a new test, and then that diagnosis was dismissed, and I would just keep getting new tests and new diagnosis. So finally, after that week, I was stable enough to be released from the hospital, was put on a statin for chronic inflammation, was told I had arterial plaque, cyst in my ovaries, was pre-diabetic, and I had some sort of blood clotting autoimmune disorder that I would have for the rest of my life. So I later got the diagnosis of the autoimmune disorder, which was antiphospholipid syndrome, and I just was floored. I had that dramatic hospitalization, but I kept on asking all the doctors I saw in the hospital, the cardiologist, rheumatologist, hematologist, oncologist, what can I do to fix me? And I repeatedly kept on hearing, and that continued even upon my hospital release when I was doing the conventional route, that you just need to accept this new reality. This is your life now. You will have to get biweekly blood draws. You will have to go to the doctors all the time. You will be on blood thinners, and you will be on a statin for the rest of your life. And I just couldn't believe it. So the autoimmune disorder, I was told I couldn't reverse, but I knew the pre-diabetes I could turn around by changing my diet and my lifestyle and what I ate. So that's where I began. And I did that just, at first it was very simple, just no more food out of a box, eat healthy, have whole grain versus white flour, white rice became brown rice, simple. I went back to my rheumatologist after 3 months, and I got hope, because my blood work was even looking that much better. And I was told at that moment that I might not have to live with this blood clotting autoimmune disorder for the rest of my life. I was told to keep doing what I was doing. That was my only instruction. So in the hospital, I was told that I was chronically inflamed. So I had already made those initial changes, and so I started to dive deeper and read every chronic inflammation book I could find. And then I decided to go back to school and get certified as a health coach and a personal trainer. And with the help of Dr. Twyman, who was a huge part in turning my health around with his
in-depth labs and learning what I was deficient in with nutrients and some enzymes that weren't producing as they should, and a genetic mutation, and all of my dietary changes, and just being rigid. I am well today, and I no longer have any of those diagnoses. But I quit my job and pursued this, and it was grueling. And with people that have health challenges, you can't just put everything aside. We understand this. This became my new passion. And I draw upon my degree in psychology, and I use that very differently than I do now. It's finding your state of change and where you are at that moment, and guiding you through the process to make those changes, and giving you accountable steps, and then setting new goals and getting those goals achieved, and then moving to the next goal, and overall it's your bigger goal of health. So I love health coaching. I've been doing it for corporations, because sadly nowadays a lot of people are chronically ill, and companies are employing health coaches now because their insurance costs are going through the roof, and it's causing problems with productivity at work, and so it's sadly kind of a growing field, because just getting people healthier naturally versus dependent on medication and being chronically ill for the rest of your life. So that's what Dr. Twyman is doing and Amanda is doing, and I'm so excited to be a part of it. So, thank you.
So those are two amazing stories, two amazing ladies that are going to help you guys get to your optimal health as well. So now we'll kind of introduce what the health coaching plans will be like, and then open up to questions about the mechanics of it and any other specific questions you have. So.
Go ahead.
I heard you mention genetic mutation, which I hadn't heard you say before.
Yes.
And how Dr. Twyman might be involved in that.
Do you want to speak to that, or do you want me to speak to that?
It's your health, I don't know.
Okay. I learned one of the issues was I had a genetic mutation called MTHFR, and there's many variants of that that can cause different problems, which meant that if I ate a ton of things that had B vitamins, B6, B12, I would not process them like everyone else would that doesn't have that mutation. So I was always deficient, where now I take a methylated B vitamin, and now I absorb B vitamins like I should.
And did Dr. Twyman give you a test for that?
Yes.
Yeah. The Cleveland Heart Lab panel has that lab on it, and almost routinely I will check it the first time somebody has that panel. So if I haven't checked it on you, just look at your old results and see if it's there. There's two gene tests. One's C677T, one's A1298C. Long words, but it'll have MTHFR on it. It's probably on page 5 of 7. If it's not there and you're really interested in getting that test done, the next time you come in and see me, we'll get it checked for you.
And if it's not bright red, you're okay.
All right. Well, somebody else want to present it, or me to?
Go ahead.
Go
All
ahead.
right.
Jump in.
All
You're
right.
running the show.
All right. Well, I'm going to read. So, a health coach is a supportive mentor and wellness authority who works with clients to help them feel their best through food and lifestyle changes. Relationships, exercise, career, and spirituality are just as important to your health as the food you eat. Health coaches understand this and take a holistic approach to supporting the whole person. We're proposing 2 plans tonight, a 3-month plan and a 6-month plan. And And there's going to be some special introductory pricing for the people who showed up tonight, and we'll talk about that at the end. So our current packages are going to include 2 50-minute consultations per month, in person or virtual, whatever you prefer. So virtual, likely over Zoom because it's a little bit more secure. The unlimited email correspondence, questions back and forth. They'll help design meal plans and recipes according to your dietary needs. So if you're gluten-free, dairy-free, soy-free, keto, vegan, whatever you are, we can help you do that. There's an app that we've been testing called Embody 360 that really is a slick way to interact with patients to kind of help them get to their goals. You know, we can push out health plan or health the tips to you, nutrition plans to you. You can take pictures of your food, send it back to us, so we can say like, portions are too small, portions too big, or don't eat that. So it's just another way to help you stay accountable. And then, you know, they're also offering, you know, the ability to do some free for you, but going to grocery stores and showing you where to shop in the aisles, how to kind of put together some healthy meals. So we'll get, you know, 5, 10 of us together, and we'll go take over a Whole Foods or something like that. There may also be some opportunities to do some kind of cooking demonstrations. You know, we'll have to find a kind of a demonstration cooking location, but we might be able to do that as well. And then, you know, we'll put together, you know, an accountability and support group. So I don't know necessarily if that'll be through a kind of private Facebook group or whatever the groups here ultimately want, but we'll have some way where you guys can kind of also help each other. So that's kind of the initial plan. So the 3-month plan, the introductory price for pretty much tonight only is going to be $1,200. For the 6-month plan, it's going to be $2,160. So now we'll kind of open it up to questions, and these information sheets are at the front. You can have them at the end, and also there's contact information for my new practice as well.
Any questions?
Questions about that?
So does the health coaching include like panels and stuff that you were talking about?
So health coaching is an ancillary to my primary cardiology practice. So I have an office here in downtown Clayton, about 3 blocks away. So I see patients there Monday through Friday and help them kind of get to the root causes of their cardiovascular disease. And I typically use a fairly comprehensive blood work panel at that location, and I can use that information with the health coaches to kind of help design a plan that works optimally for you.
So Amanda and I don't know.
Angela.
Angela,
Amanda and Angela are health coaches.
that's correct.
You are the doctor, so then we would start with you or start with them?
It can be work either way, because you know, some of these faces in here are very familiar and have been seeing me in my prior practices for years. So I will continue to see them as patients, and if they so choose to do health coaching, which I would highly recommend because it helps you get to your goals faster, I'll help oversee this plan for them. So if they've had blood work with me, I'll kind of help guide Amanda and Angela to say, okay, these things will probably work a little bit better for them. If a patient hasn't previously worked with me in the office, but they have their own primary care doctor, their own cardiologist that they're comfortable with, they don't necessarily need to see me in the office. They can work with these ladies directly. Yes, ma'am.
And Amanda and Angela will be located in your office?
That's most likely yes. And yeah, those are a little bit up in the air depending on the demand. My office will be available. There's also options if it's a little bit bigger. We might rent out space in
If
this
we
location
do
as well.
group activities where we need larger,
Right.
a larger
But it will be
footprint.
located somewhere, either probably this location or my office that's on Forsyth in Hanley.
And there is also the option to coach virtually. So in my private practice for the last 2.5 years, I know that there have been times when people aren't able to, you know, they really want to meet their goals, but they have this full-time job, they're stuck downtown, they're not going to make it there, but they know they can squeeze in that lunch break, you know, every other week to where we can have a good quality coaching session virtually. And I'm always very happy to do that. It works just as well as in person. So yeah, that's also an option.
Yes, sir.